Hello and welcome. As everyone is getting settled, we'll be getting started here in just a moment. Thank you so much for joining us for today's webinar Wednesday. I am Julie Matusik and I will be presenting for today's webinar. And so if you're joining us online, just want to go over a couple small housekeeping items here. You will listen directly through your computer speakers. And if you have joined via the phone number provided by Zoom, your line has been muted to minimize background noise. And for those of you that are online, please note there is a link in the chat, or will be momentarily, that you can access to access the handouts at any time. So feel free to download those, save that link for later. And in addition, you can put questions that you may have in the Q&A section at any time. We also have the chat available for you to use. Feel free to toss in some comments, show your peers some love that are here today. I will have that chat open for you. But we do ask you to direct any questions that you may have during that Q&A portion of the Zoom console. If you are having any tech issues, we have live tech support that is here and able to help you. And so it says Mary is here on tech. And so you'll see tech right in front of her name. So feel free to message her privately if you have any tech challenges, such as audio or not able to access something, for example. And I will try to get to all of the questions at the end of the webinar. And if I'm unable to, if we run out of time, someone from the National Family Support Network will follow up with you after the webinar. Also want to mention that today's webinar, as well as the handouts and a recording of this webinar, will be available on the National Family Support Network's website on the Webinar Wednesday page by this time tomorrow. So when you exit the webinar, an evaluation will automatically appear on your screen. So we ask that you take a moment to complete this, as it provides us with some very valuable feedback to inform future webinars. All right, so now let's take a moment to get an idea of who is on this webinar Wednesday with us today. So take a moment to look at this map here on the screen. And when you're looking at that map, identify which region of the United States you're joining from. And we have launched a poll for you to let us know which region of the United States you're joining us from. And we also, there's also an option for Canadian folks. And if you are joining us from outside of the US or Canada, just let us know in the chat where you are joining us from. All right, I'll give you about 5 more seconds to respond to this poll. All right, let's see those results. Oh, and I see we have Puerto Rico represented. That is fabulous. So glad that you are here. Welcome. Okay, so it looks like our strongest representation is from the Midwest, closely followed by the West, Southwest, Northeast. We have folks from Canada and Puerto Rico today. That is awesome. Thank you so much for responding to that poll. All right, so we have a couple other polls just to gauge who's here in this virtual room with us today. The next one is about your affiliation. So let's take a moment to let us know what your affiliation is. So maybe you work for a family resource center or another family support program. Maybe you're working at the Family Resource Center network level. We have government and child welfare, and then other government folks. Maybe you're a private funder, an education, or a consultant. And of course, if you fall into the other category, we have that as well. All right, take about 5 more seconds. All righty, see those results. Very cool. We have almost all all of these different affiliations represented. That is very exciting. Looks like our strongest representation is from education. Very cool, as well as family support programs and family resource centers. Wonderful. Well, we are so glad you're here today. All right. Last poll for now is about your role. So let's see. So which level you're working at? So are you in the policy systems level? Are you working in management at your organization? Or are you working directly with families at the program level? And of course, we have that other again. So take about 5 more seconds and let us know which level. Great. All right, let's see those results. Great. So it looks like we have a diverse representation here as well, with the strongest representation of folks working directly with families and at that management level. Wonderful. But we do have policy and systems here too. So awesome. Great. Well, thank you so much for taking the time to respond to that. Those polls, we'll have a couple other ones as well throughout the presentation today. So I want to share some background information with you, starting with this. So you can see here, over the last decade, the National Family Support Network, we have actually quadrupled in size. So we now are up to 38 member networks. And so that's 37 states and the District of Columbia. And that represents more than 3,000 family resource centers that serve more than 2 million people annually. And our newest member is Louisiana. So very excited to welcome them aboard. And here you can see our areas of work. So our first area of work is connecting and convening member networks to enhance their effectiveness. And so increasing the connectedness amongst members for peer learning and for mutual support. And our second is related to promoting family support best practice and evaluation. So raising awareness of what quality family support is and promoting a common language, standards, and evaluation of it through the national implementation of the standards of quality for family strengthening and support. And our third area of work is raising the visibility of the value and impact of family strengthening and support networks in order to strengthen and increase support for families. So those are the national network's 3 areas of work. And let's look at this slide together. Here you can see our roadmap of what we are going to be covering together today. Lot to cover. And so kicking off with some background information, we'll provide a general overview of the standards of quality, and then we'll talk about the standards at the program level and at the systems level. And we'll have an opportunity for question and answer. And then we'll close with some resources and opportunities that are available to you through the National Family Support Network. And we'll officially close with the completion of that evaluation. So let's dive in. So when we are talking about the standards, our focus is on families, particularly those that are responsible for raising children. And these families, they consist of at least one adult and one child who are related biologically, emotionally, or legally. And families may consist of one parent, two parents, grandparents, foster parents, legal guardians, or they may arise from a need for mutual support. And looking at the development of the standards, here you can see on the slide where it all began, which was in California. So back in 2012, the California Network developed the standards of quality for family strengthening and support. And then in 2013, the National Family Support Network adopted them for national implementation. And then in 2020, the National Family Support Network engaged member networks from across the country, including parent leaders, Canadian family support organizations, and the Center for the Study of Social Policy to review and to revise the standards with a focus on diversity, equity, and inclusion, as well as the relevance for both the United States and Canada. And then last year, that new version was officially approved by the National Family Support Network membership. So when we're talking about these standards, they are important for several different reasons. So these standards help ensure that families are supported and strengthened through quality practice. They also create a common language and expectations across different kinds of family strengthening programs. And they are designed to be used by all stakeholders. So everyone coming together, public departments, foundations, community-based organizations, families, all using them as a tool for planning, providing, and assessing quality practice. And these standards, important to mention, and we'll say it again, we'll keep saying it, that we're not selling these standards. We want everyone to have access to and be able to think about quality work with families. So you can access the standards themselves and download them for free. You can also access all of the implementation tools that go along with the standards as well for free. So if you go to the website, you'll be able to access and download the standards as well as those tools. So as we're talking about the standards, want to think about, and we did that poll earlier, where asking which group you represent. And that directly relates to this slide where we're talking about how you can use the standards. So for those of you that are working in the program level, so maybe a family resource center or similar program, you can use the standards as a blueprint for implementing best practice for self-assessment and to demonstrate quality. And if you're working directly with families, you can use the standards to reflect on and enhance your work with families. If you're working at the network level, you can use the standards for quality assurance, for training and technical assistance, and you can adopt them as an expectation for membership. And policymakers. I know we had some folks at the system level, which is so exciting. You can use the standards to endorse for your application in your areas of influence. If you're a funder, I know we had some funders here as well. If you are a funder, you can use the standards to integrate into requests for proposals and for monitoring and quality assurance. And families can partner with programs to apply the standards. Families can also provide feedback about how well the programs are applying the standards. And so let's talk about the application of these standards. It does require the commitment and the support of all levels of program responsibility. So requires executive directors, managers, coordinators, direct service staff, parent leaders, and families all coming together to apply the standards. So the standards, they uniquely integrate and operationalize two key frameworks from our field, and these are the foundation for the standards. So the first framework that the standards are based upon is the Principles of Family Support Practice. They were developed by Family Support America, and the research-based and evidence-informed Strengthening Families Protective Factor framework and that approach that was developed by the Center for the Study of Social Policy. So we're going to dive into talking about the first principle, but the first framework, which is the principles. But before we do that, curious how many of you have heard of this framework before today. So we are going to launch a poll and gauge how many of you have heard of these principles before today. So take a minute to let us know if you've heard of these before today. All right, take a couple more seconds. And let's close that poll out and see our results. All right. Looks like it's close to 50-50. Slightly more than half of you haven't heard of these principles before today, which is okay. No worries there. We are excited to share them with you. So for those of you that have, this will be a little bit of a review. So let's dive in. So these principles were developed by a national organization, Family Support America, and back in 1981, these were created, and they very much continue to guide and frame the field today. So that organization has since sunset, but these principles are still important as the foundation for the standards. So let's walk through these together. So the first principle is that the staff and families work together in relationships based on equality and on respect. So this principle may not seem so revolutionary today to us in 2022, but at the time it was written, it presented quite a challenge to the system. At the time, the prevailing wisdom was that the staff were their experts and they came in with their education, their knowledge, and their experience, and that their goal was to quote unquote fix the problem families. But this principle, this challenged that notion by saying that staff and families are actually equal. So staff do, of course, come to the table with their knowledge, their education, and experience. But the families also bring their own strengths and resources and are the most knowledgeable about their past experiences. And it is by working as partners in relationships based on equality and on respect that we will achieve the best outcomes for that family. The second principle says that the staff enhances the family's capacity to support the growth and the development of all family members, so adult, youth, and children. So this principle, it emphasizes that we in this field are looking at the whole family, not just the individual. So if one member is coming to our activities, participating in our program, we want to ask about and invite other members of the family as well. We know that when more family members, multiple family members are involved, that the family is more likely to have better outcomes. And the third principle, yeah, and I see in the chat that that continues to be an issue. Absolutely. It's, yeah, there's still a lot of work to be done. Reflecting on the growth that we've had in this field, but still certainly work to be done. Absolutely. Our third principle says that families are resources to their own members, to other families, to programs, and to communities. So, unique to the family support perspective is that we do not see staff as having all of the answers or doing all of the work to support families. Families themselves are encouraged to support other families. So there's a strong emphasis on connecting families to share resources such as information and for peer support. All right, let's look at the next few principles. Principle four says that programs affirm and strengthen families' cultural, racial, and linguistic identities and enhance their ability to function in a multicultural society. So, this principle is commonly referred to as the diversity principle, and it has two parts. So, the first is about respecting and welcoming the diversity that families bring, and whether that is linguistic diversity, cultural diversity, family structure, things like that. And the second part is about preparing them for and connecting them with the larger community where they will naturally interact with people that are very different from themselves. So, this supports them to fully participate in our diverse society in which we live. The fifth principle says that programs are embedded in their communities and contribute to the community building process. So, family support programs do not see themselves as simply social service providers, but as community builders as well. So, by strengthening families, they make key contributions to the health of our own communities. And they also work to develop families' responsibility and leadership for strengthening and building their communities. All right. So principle 6 says that programs advocate with families for services and systems that are fair, responsive, and accountable to the family served. So think about some of the major systems that families commonly interact with. Feel free to put them in the chat. Maybe education, healthcare, the legal systems, and then reflecting on those. Are these systems fair and responsive and accountable? And often not. So that's where our work comes in as family support providers to work with families to help improve these systems. All right. Principle 7 says that practitioners work with families to mobilize formal and informal resources to support family development. So there is a strong emphasis on in this family support field on resources. So coincidentally, the most common type of family support program is called a family resource center. So you can see right in the name that emphasis on resources. And while no one program could directly provide all of the supports that a family needs, it's our responsibility to know how to connect them to them. All right. Principle 8 says that programs are flexible and continually responsive to emerging family and community issues. So, this concept of flexibility and responsiveness are really important in our family support field because neighborhoods and communities change. A neighborhood that might be majority Latinx today might be majority Asian in 5 years, and issues emerge that significantly affect families, such as economic downturn or the pandemic. And programs need to be flexible and responsive to these changes. And our last principle is that the principles of family support are modeled in all program activities, including planning, governance, and administration. So, this is our catch all principle because it says that all of the above principles should be applied in everything that we are doing, whether it's planning, governance, or administration. So, these principles have implications for how we develop programs, how they're led, and how we support our staff. All right. So that's the first framework that these standards are based upon. And want to introduce you to the next framework. But before we do, curious how many of you have heard of the Strengthening Families Protective Factors framework before today. So we're going to launch a poll here and you can let us know. Have you heard of this framework before today? All right, take just another moment if you haven't responded just yet. All righty, let's see those results. Awesome. Okay, about 50-50 again. Well, for those of you that said yes, great. This will be a quick review. And for those of you that said no, in a few moments, you'll be able to say yes too. So great. All right, so let's dive in here. So this framework comes to us from the Center for the Study of Social Policy, and they were created in 2005, and they are research-based and evidence-informed. And this framework has been shown to increase family stability, enhance child development, and reduce the likelihood of child abuse and neglect. And here on the screen, you can see the 5 protective factors. So they are parental resilience and social connections, concrete support in times of need, knowledge of parenting and child development, and the social and emotional competence of children. So that's the 5 protective factors. If you're interested in learning any more about them, there's so much on the Center for the Study of Social Policy on their website. If you go to cssp.org, and you can click right on the Strengthening Families portion of their website, and you can learn all about them. Encourage you to check out that framework more. So now that we have looked at the 2 frameworks that the standards are based upon, let's talk about the 5 sections of the standards. So each of these 5 sections represent key elements of quality practice in our field. So family centeredness, family strengthening, diversity, equity, and inclusion, community strengthening, and evaluation are all each 5 sections of this standards. So we'll talk about them in more detail, but those are the 5 areas of practice. So looking at the structure of the standards, there are 15 of them, 15 standards themselves, and each standard includes 1 to 2 sets of indicators of both foundational quality and high quality. So the foundational quality, these indicators demonstrate the basic application of the standard, and then programs build upon the foundational quality indicators to achieve high quality indicators, which represents deeper integration of the standards. And then each indicator is followed by 2 to 4 examples from the field that illustrate its application. So these examples are provided as illustrators and are not meant to be a checklist or limited to the one-sided at all. And then in the standard certification training, a significant focus is on participants thinking of their own examples and thinking about how they demonstrate the indicators in ways that are relevant to their own programs. So as programs are applying the standards, they are encouraged to identify their own examples that demonstrate the indicators in ways that are relevant to their very own communities. All right, let's look at this continuum together. All right, let's look at these together. So on the left side, you can see that the foundational quality indicators create a solid foundation. And then these foundational quality indicators are designed to be met within the basic resources of a typical family support and strengthening program. And then high quality indicators are built upon foundational quality being in place first. So we aren't just jumping to high quality, we have to have that solid foundation under us. Programs are encouraged to strive to meet high quality indicators in order to serve families most effectively. And some high quality indicators may require additional capacity building, additional resources to meet. Let's look at the continuum down here together. Let's look at that at the bottom. So we start on the left with foundational quality not yet addressed, and then we approach foundational quality, and then we meet foundational quality. Right there in the middle, that is where quality begins. And then we continue to the right, we continue along that continuum to approach high quality and meet both foundational and high quality. You'll see at the bottom, the arrow keeps going after you have already met foundational and high quality. This is because quality improvement, it's an ongoing continuous process. And that is why high quality is not called maximum quality. And also want to mention here too, that implementing these standards, it's very much a developmental process. And it is common that programs may see aspects of their work at different points along the quality continuum. So as we are going through the standards, you may determine that you already are doing quality work in some areas, and hopefully you can identify areas to work on further. All right, so let's look at this arrow. For the first 4 sections of the standards, this is the arrow that we use to explain the movement from foundational to high quality. On the left, we see foundational quality, and on the right, high quality, which represents deeper integration of the standards into the program. So what moves us from foundational to high quality are the arrow elements, and they are formal structure, staff training, and family partnership. So formal structure, these are things like design, policies, procedures, and intentional strategies with committed resources that ensure consistency of practice. And then we have staff training. This is staff training to support the implementation of the standard. And then we have family partnership. So family partnership, it means partnering with families in the implementation of the standard itself. So each of these elements help ensure that the standards are more deeply integrated into program practice. So for example, at foundational quality, we may do something that's good practice, but how are we ensuring that it wasn't just a one-time occurrence? And then at high quality, we have actually set up systems and training, and or we have partnered with families to ensure that it continues to happen. So the particular elements and the number of elements that are needed differ for various indicator pairs. So sometimes it's one of these, sometimes it's two, sometimes it's all three, but it's never anything other than these three that moves us to high quality. All righty. So let's look here. We want to show you an actual sample from the standard. So the standard here is that the program engages families to participate in program development and implementation. And we have the section header at the top. And then down below, we have the foundational and high quality indicator here. So the foundational quality indicator is that the program solicits input from families to shape and plan the program and services. And then let's look at the difference between foundational and high. So the high quality indicator here is that the program's design supports partnering with families to have an active role in the development and implementation of the program. So the difference here is where we're looking in the arrow. So formal structure and family partnership are the elements that move us here from foundational to high quality. All right, so this arrow, the evaluation section, is so special that it gets its very own arrow. So as with the arrow that we just talked about for the first 4 sections of the standards, this arrow for the evaluation section also has foundational quality on the left, high quality on the right, which represents that deeper integration into the program again, but the elements in the arrow are different here. So the elements that we have here are data. First one's data analysis. So this collecting data is foundational, but then analyzing the data is what moves us to high quality. And then sharing evaluation results. So we're sharing them with various stakeholders, such as the families that we're working with. And then program modification. So this means changing the program as a result of what we learned from evaluation. So we aren't just filling out forms and doing evaluation for evaluation's sake. We're actually doing something with it. So want to talk to you about the implementation tools that come with the standards. So the first one is the program self-assessment tool. So this is designed for programs, program teams of managers, direct service staff, parent leaders, all coming together to reflect on standards, implementation, and quality improvement. So this tool is designed to be used as a critical thinking exercise by program teams. So managers, direct service staff, parent leaders, all coming together. And it's recommended that all team members involved in using this tool have been trained on the standards first. All right, so that's the first tool. The second is the staff reflection tool. So this consists of 18 questions for staff members to use as an ongoing reminder of how to implement these standards. So staff are encouraged to put these in a place that they can see them regularly, such as above their desks. And the participant survey is a fabulous tool as well, and shows how well the program is meeting the standards from the participant's point of view. So it's not a typical satisfaction survey, and the questions actually mirror those that are on the staff checklist. So if staff members are mindful of the questions in that last tool, then program participants are likely to give the program high scores. So all of these tools are available on the National Family Support Network website, on the implementation page, and they are included in the standard certification training. All right. So speaking of training, want to talk about this real quick. So training is a fundamental strategy for implementing the standards effectively. So certification trainings are either in person or virtual. They're all virtual right now, but they are designed for all management and direct service staff as well as for funders. So participants receive a certificate that is valid for 2 years from when they are trained. So the certification training is conducted by peers of trained trainers from across the country in our member networks of the National Family Support Network. And networks, funders, and other stakeholders can also contract directly with the national network to host the standard certification training in their area if there's not already trainers in your state. And programs are encouraged to come as teams of both management and direct service staff because it's so important. Successful application of the standards, it does require the commitment and support of all levels of program responsibility. And also important to mention that individuals are certified intentionally rather than organizations, which integrates the standards into everyone's work and provides a professional credential for staff. And all trainings are live intentionally because the group work and the peer sharing are so valuable to the process of learning about the standards. So then looking one level up at the Training of Trainer Institute, this is a 4-day in-person or 5-day virtual training for representatives of National Family Support Network member networks to be able to conduct the certification training in their own state. So only network representatives that are trained to be trainers, so that's intentional. That actually supports the network's capacity building and establishes a unique, essential, and ongoing role for them within their system of support for families in their area. Let's take a look at this map together. It's so exciting to see this map get updated every month. So this is, you can see that over the past decade where the standards have traveled across the country. So over 12,000 people have been certified on the standards. We have well over 100 trainers that are actively providing this training currently in NFSN member network states, delivering these trainings. And you can see this is a highly rated training. And it's wonderful to see where the standards have been. Here you can see a little bit about what folks are saying after the certification training. Um, Most folks are indicating that their work with the standards have improved and enhanced their program's work with families, which is the goal. So it's great to see that's happening. And most folks that are have been trained on the standards are then going on to use those implementation tools. We talked about those 3 tools, and most of the programs are using at least one or more of those tools. And on this slide, I'll give you a moment to read over these quotes that come directly from those that were trained on these standards and how it's impacting their programs. All right. So, as you can see here from reading those quotes, these standards help validate existing work and by benchmarking it to national best practice. So, supporting network development, the member networks have formed and expanded through the standard certification training. So, for example, in Arizona, the standards provided a common language for diverse providers across the state and also established a key role for the Maricopa Alliance, Maricopa Family Support Alliance, sorry, in promoting quality family practice within their system of care. So as a result, that alliance grew from 21 to 72 agencies in just a few short years. And networks also were strengthened, their capacity was strengthened, and their sustainability improved through developing trained trainers. Also important to mention that all funds that are generated through the standard certification trainings are invested back into supporting networks. So, in order to ensure the accessibility and the affordability of the standard certification training, networks with certified trainers can charge up to $150. So, intentionally keeping it very affordable so everyone has access to this training. So, let's take a look at this continuum. So, if you indicated you are working at the program level, such as at a family resource center or other family support program, that's one type, that's one group that would use this tool. And this is available in that handout section for you to download. I know this is small on the screen and hard to read. So I encourage you to get that from the handout section, or you can also get it directly from the website as well. So let's talk about this. If you're at the program level, we have steps across the top, and we have the sample activities for each of those steps. And then below that, you can see the resources that are available to you through the national network to implement these activities, and then the potential costs associated with each of them. So congratulations to you all. You are all at the prepare phase just by being here today. Participating in this webinar is one of the steps in that phase. So as you continue along, you'll see the other steps. And also wanted to share with you a little bit about using these at the program level. So prior to joining the National Family Support Network, I joined the NFSN team a little over 4 years ago. I managed the Family Resource Center in Corning, New York, which is in upstate New York, the Nunnyhood Parent and Family Resource Center. And when I began working at that Family Resource Center, we were implementing the Strengthening Families Protective Factors. So that one framework that we talked about, as were the other family resource centers across our state. So we were doing a lot of great things. So we used the protective factor survey. We provided drop-in play opportunities. You can see the space there in the photo. We had parent-child groups and activities, provided parent education, did parenting groups. We facilitated the ages and stages questionnaire screenings. We provided information and referrals. We had a supervised visitation program, did a lot of community events. So we were doing great work at the center, serving families as best we knew how at the time. And then in 2016, the New York State Family Resource Center Network they actually became a member of the National Family Support Network and contracted with the NFSN to bring the standards of quality to family resource centers in New York State. So managers, direct service, directors, everyone, all those different levels from across the state participated in this certification training. So 12 of us in New York State became trainers on the standards to create more capacity across New York State as we began implementing the standards. So through implementing these standards, our Family Resource Center saw that the standards were very much enhancing the work that we were already doing. So we were able to increase childcare offerings for parent education classes to better meet parents' needs and to ensure that we were reducing as many barriers to participation as possible. We also intentionally improved partnerships with families. So the staff began to work with families more to complete parent identified needs and goals, recognizing that parents are the experts on their families. And the standards also gave us the structure to increase the formal structure around our outreach strategies. So, not creating extra work, but helping us to work smarter, not harder with our efforts. And the standards also helped us to improve our database system. Um, we actually started analyzing our data, making sure that our programming was doing exactly what we wanted it to do. And the standards, they helped us to create new opportunities to educate parents on advocacy and on leadership. And also through adopting the standards, we realized how crucial it was to have parents formally at the table, um, to develop and to plan programming. And then just 2 short months after I participated in the standards training, I actually had an opportunity to participate in the inaugural Developing and Sustaining Effective Parent Advisory Committee training, to gather concrete tools about how to start a parent advisory committee. So once we started that parent advisory committee, it was so exciting to see the enhanced ownership that families now had. So that's just a little bit about my journey with the standards at the program level. So looking one level up at the network level, I know many of you on the webinar today represent the network level as well. So this, similar to the other tool, looks identical, but this one's for folks working at the Family Resource Center network level. So it gives you those steps, sample activities, resources, and costs associated with each of those steps as well. So again, this is available for download in the handouts folder that was shared, and it's also available on the website as well. So just want to share briefly a little bit about the standards implementation at the network level in New York State. So I had mentioned a little bit about the program level. So at the network level, the New York State Family Resource Center Network became a member of the National Family Support Network in 2016. And then we immediately began training on the standards across the state. So the New York State Network also was the funder of the Family Resource Centers here in the state. So they intentionally wrote the standards in as one of their grantee requirements to ensure quality and to ensure consistency in programming. So all programs across the state began using the standards implementation tools and completing that program self-assessment tool annually. And the network today continues to use the standards as a catalyst for enhancing their work with families across the state. All right, I want to share with you a couple other network implementation examples. So this is another example of another network that demonstrates how they implement these how they demonstrate they're using the standards in their state. So they're using a three-pronged strategy that integrates them into training, evaluation, and membership. So each network is encouraged to develop their own network level implementation continuum. This is another diagram. You can see another implementation example for Family Resource Center staff, and this one comes to us from the state of Colorado. So all staff at the centers are, regardless of their roles, are completing the one-day that's initial standard certification training, and then the staff that are working directly with families, as well as their supervisors, are completing the free 14-hour online strengthening families training that's offered by the Children's Trust Fund Alliance. And then staff that are working directly with families in case management roles are completing the 60-hour family development credential. So just wanted to share a couple of those network implementation continuum with you. So as you're reflecting on what was shared, why you might think about adopting the standards. So some considerations for you as you're considering adopting the standards. One is deepening practice, establishing a common language across different kinds of programs. It's an opportunity to develop partnerships and also to utilize a shared measurement system. Our field didn't have that before this. And also to do something concrete to advance diversity, equity, and inclusion. And also, it's so exciting to be part of a national movement. And so after these webinars, folks would email us and say like, oh, this sounds great. What do we do next? How do we learn more? So we drafted this slide as some suggested next steps after this webinar. So if you haven't already, download the standards and review them, like see what they're all about. You can dive right into those. We also encourage you to use those two continua that were shared and plot out possible next steps along the program or network implementation continua. And we also recommend that you participate in a standard certification training. So if you have if the standards are, if you have trainers in your state, you can contact them they can let you know when their upcoming trainings are. And if you don't have trainers in your state yet, fear not, we can either work with you to bring the standards to your state, or you can participate in one of the open trainings, and I'll share more about that too. All right, I'm going to pause here just as a placeholder to, if you have not already entered in the questions at all into that question and answer panel, please take a moment to do that. It's really, really great to hear what you're thinking about, what resonated with you, what you're thinking about for next steps, any questions that you might have about those next steps. Would love to hear from you. While you're thinking about that, while you're thinking about any questions you may have, I want to share with you some upcoming opportunities that are available to you through the national network. So we have coming up later this month, in a couple weeks, we have a webinar Wednesday on developing family resource center networks and where to begin. So check that out if you're one of those folks that are working at the network level today. You can register for that on the website. If you have any colleagues that did not have the opportunity to join this webinar today, you can either share the recording with them tomorrow afternoon. You also can direct them to the August webinar, which is coming up, and they can catch it live then. We also have a plethora of webinar Wednesdays in our library. So related to the standards, there's a whole page where you can start diving into what other states are using the standards, learning about them. You can listen to those recordings. So encourage you to check those out. I had mentioned the open standard certification training. So these are open to anyone, and registration is still open for a couple more weeks for the July training. So you can scoot right into that. And we also have opened the August training as well. So encourage you to check out this. If you go to nationalfamilysupportnetwork.org, and then you can click on the standards and drop down to the certification training. Or you can do it right from the homepage. We have the links right on the homepage as well. So this is that virtual standard certification training. No travel required. And I also mentioned the developing and sustaining effective parent advisory committees training. So I had the opportunity when I was working at a family resource center to go through the very first training that the national network had offered on this. And since then, it's just grown and expanded, and it's now offered monthly. And so whether you're starting a new parent advisory committee or wanting to strengthen an existing one, it is a phenomenal training, very concrete tools, and you can It's co-trained by a NFSN staff member and an experienced national parent leader. So a very rich training. I encourage you to check that out as well. You can participate in one of these open trainings, or if you want to get your whole team trained, reach out to us and let us know, and we can bring this training to your state. So let us know if you have any questions or anything about that as well. The Together for Families conference is our big tent conference. It's literally for everyone. It's coming up in October. This is every other year, our biennial conference. It's unique. It's a unique virtual event that connects various stakeholders from across the United States and Canada in the family support and strengthening field to focus on best practice and promising practice in the supporting families advancement. So we have, if you go to togetherforfamilies.org, you can check out the different tracks. You can see who some of the presenters are, the speakers, plenaries, all of that's on there. And early bird registration is open, and that reduced rate is good through the end of July. So if you want to slide in at that reduced rate, be sure to get your tickets for that. Let's see here. All right, and this is my contact information and my colleague Jennifer, and she would be your point of contact for anything membership related. So if you're interested in learning more about NFSN membership, she would be your point person. And if you have further questions about the standards, encourage you to reach out to us. So let's turn to these questions. In the Q&A panel. So there's a question about contact information for trainers in your area. So if you go to nationalfamilysupportnetwork.org and hover over standards and then drop down to certification training, you will you'll be able to see all of the upcoming trainings. And then down towards the bottom half of the page, you can see the states that have trainers. And so if you see your state listed there, you could email the point person and say, hey, I'm interested in a training. When is your next training coming up? They could let you know. If you happen to not have trainers in your state, you could definitely access the open certification trainings that I just mentioned a few moments ago. We have those monthly. So, but definitely let me know if you can't find that. And there's a question. I just want to make sure I understand it clearly. There's a question about community schools. So I've heard of community schools. I'm not I don't have a lot of background information and their use with the standard. So that's not something I'm super familiar with, but if you wanted to email me, feel free to reach out, and I might not be understanding the question correctly, but the standards are definitely intended to be used by everyone in our field, regardless of the type of program. It's something I know in our area, whether it's library staff or family resource center staff, childcare resource and referral, regardless of the type of program, it's applicable. Home visiting, just the full schools themselves. And my email is right on the screen here. It's julie@nationalfamilysupportnetwork.org. And you can also access that from the website. And are there any other questions? Yes. Okay. Yeah, definitely feel free to reach out with questions related to your particular state. Would love to connect with you. And as you are, if there's no questions here in another moment or two, we'll be wrapping things up. Just as a reminder, when you are exiting the webinar today, an evaluation will automatically pop up on your screen. So we appreciate you taking the time to answer those questions, because it very much helps us with planning for future webinars, and it also helps identify your next steps and how we can support you. So thank you so much for your participation in today's webinar. Mary has put the link in the chat to the handout section, which has all of those all of the different tools that I mentioned, and as well as the PDF to the PowerPoint. And if there's no other questions, feel free to email if you think of any questions after today. I know I always think of these questions after I've ended them, so completely understand. Don't hesitate to reach out anytime to myself or my colleague. We hope you have a fabulous rest of your Wednesday. Thank you for joining us for today's Webinar Wednesday. Have a great day.